Okay guys, so in this video we're going to go through the cervical spine deep neck flexor exercise. So we're first going to go through just a quick test for that, and then we'll go through the exercise that you can do in order to improve that. So what we would do for this is we'll just come onto Patrick's chin. I use a finger on the chin, a finger on the back of the head. All I'm going to say is, Patrick, if you tuck your chin in and then just lift up the back of your head like I was going to put a piece of paper underneath and hold for 10 seconds. And we're looking for what the chin does. Is there any extension of the chin? Is he holding it easily and relaxed? A lot of people will find they'll lose that retraction and get that extension, and that would show that there's a bit of weakness there. If they're finding it really hard, and again, talk to the patient afterwards, say, how did you find that? 10 seconds they should be able to do fairly comfortably. And if they can't, then that suggests that there's a bit of weakness there. Then what you could do is at home get them to do that and use 10 seconds, 10 repetitions. So 10 reps of 10 seconds, or build their way up to doing that. So it might be 10 reps of 5 seconds to start with and then building up. Obviously that's going to depend on the patient in front of you. Again, I like to facilitate finger and or 2 fingers on those 2 points, chin and an occiput essentially. And then relax. Just for the first few repetitions, relax down, Patrick, just so that they can feel the position that they should be in. So it just means that they get that sense of where they should be. This sort of thing can be used with biofeedback as well, just like the pelvis when you're looking at control of lumbar extension. But I tend to just do it by eye. Obviously you're looking at that chin poking position, or that protraction of the chin, that inability to keep that retraction. And I often find with problems with the upper traps and these sorts of issues, sometimes that can be a defense mechanism because they haven't got that stability and strength of their neck, so everything else is tightening up around there. So actually by strengthening some of the muscles around the postural or deep neck flexor muscles, you can take some of that pressure off the sternocleidomastoid, your upper fibers of traps, levator scap, and you can reduce that tension down. Obviously if you're doing lots of soft tissue stuff around that upper neck, and maybe some mobilization techniques, and things aren't massively progressing, and then you might want to think about the deep neck flexor exercise, because again strength is a big component of rehab, and if we're not covering all of our bases, you might find that you're not getting the optimal results. So that is our deep neck flexor test and exercise to strengthen up those deep neck flexors of the cervical spine.